Go ahead.
The broadcast is now starting. All attendees are in listen-only mode.
The Learning Lunch will begin in 15 seconds. Stand by. Welcome, everybody, to another ForMedApproved.com Learning Lunch. I'm Roberta Mullen, Editor-in-Chief of High Tech Answers and a contributing author to ForMed Approved Hit Answers column. I'm delighted to be here today to be your moderator. Today's Learning Lunch will cover understanding the HIPAA risk analysis. A few notes before we begin. If you have any questions during the session, please enter them in the chat area on the dashboard during the presentation. Use the select and send to the organizer and the panelists, and we'll all see those questions. We will address as many questions as we can and have time for during the Q&A. For those questions we do not get to, they will be posted and information supplied in email sent to you later this week. The emails will also contain links to both the recording and slides for today's presentation. Let's get started. Sarah? Next slide, please. We are joined today by the Falker Group founder Brent Allen and President Zion Zarif. They're subject matter experts on risk analysis, risk assessment, HIPAA compliance, and remediation. We're excited to share their expertise with you. Thanks for joining us today, Brent and Zion.
Thank you. Great to be here.
Brent, tell us a little about yourself.
Okay, well, I founded Falcor about 11 years now, going on 12 actually, and so I'm basically the founder and owner of it. I act as the CEO for Falcor. My primary role is interfacing with clients on all areas of technology. The focus for today obviously is around HIPAA compliance. We also work in the SOC compliance area with financial organizations, very similar type security requirements in those areas, just kind of a different audience. Wanted to introduce Zion. I understand that he is not, we don't have a picture of him there in his bio. Zion has recently been promoted to president of the organization. But prior to that, he headed our security practice here at Falcor. And Zion, I don't know if you want to add anything more to that?
Sure. Good morning, everyone. My name is Zion Zarif, president of Falcor. I've been with the organization since 2006. And kind of worked my way up through the ranks. Started out with a focus on infrastructure consulting, moved into the compliance arena, and now moving into senior management. At Falcor, we have a strong focus on HIPAA compliance. We've got a strong track record helping organizations of all sizes with being HIPAA compliant and meeting the requirements within particularly the HIPAA high-tech security rule. So very thankful to be on the broadcast, and we're looking forward to speaking with everyone.
Well, it sounds like we have just the right people to answer our questions about understanding the HIPAA risk analysis. Thanks for joining us again, guys. Let's get started, and let's start with the obvious. Let's talk about what is a risk analysis and why is it important?
Well, let me address this really quick. The most compelling reason is that it's required to be, you have to have a risk analysis to be HIPAA compliant. But before we really get into this a little bit, Zion and I were talking before the event started here, and we thought it might be a good idea to define some key terms just to make sure we're all working from the same dictionary. So Zion, if you want to go over some of those terms and their definition just to make sure everyone understands what we're talking about when we start throwing acronyms around, that'd probably be a good starting point.
Absolutely, and this is one of those points that for those of you that like to take notes, which I do all the time, this is where you probably will want to take a couple of notes. The first term that we need to talk about is vulnerability. So a vulnerability, as defined within the HIPAA security rule, is a flaw or weakness in system security procedures, design, implementation, or internal controls that could be exercised and result in a security breach or violation of a security policy. So vulnerability is definitely a key term. Risk, which is a major term for this discussion because we're talking about risk analysis, is the likelihood that a given threat is going to be exploited. Thus, exploiting a given vulnerability. So the risk is basically the likelihood that a vulnerability is going to be exploited. Risk analysis is considered, as far as HIPAA is concerned, it's an accurate and thorough assessment of potential risks and vulnerabilities, particularly relating to confidentiality, integrity, and availability of EPHI. And you might be asking yourself what EPHI is. That is literally electronic protected health information. And there are a number of things that cause a particular data set to fall within the category of EPHI. But for the purposes of this discussion, we're focused on data that could potentially identify an individual, data that is created or received by a healthcare provider, a health plan, an employer, or a healthcare clearinghouse, as well as an insurance company, and data which relates to the past, present, or future physical or mental health condition of an individual. So these four key terms really are going to be things that we'll use throughout this discussion, and it's very important that we're all speaking, as Brent said, from the same dictionary. Now we can move on to the first question. Brent, would you like to take that?
So in terms of the HIPAA risk analysis, what is it and why is it important? Again, from the very standpoint, you can't be HIPAA compliant without doing a risk analysis. The government's a little bit unclear on how often you have to do one. Our recommendation is annually. If you're doing it annually, then you're probably you'll be fine if you are ever audited underneath the HIPAA guidelines. The consequences of not performing a HIPAA risk analysis are twofold. One, you're not in compliance, which is the simple answer. But you do put yourself at risk if that data is ever breached of some very significant fines and actions by the government. The term of what is a HIPAA compliant risk analysis, Zian, I'm going to let you go into a little bit more detail on that, but that basically encompasses the EPHI that he just talked about, your vulnerability assessment in terms of how we can access that or how it is accessed, and is it vulnerable to somebody getting hold of it that shouldn't be, and then your whole IT stack from that standpoint, from a security standpoint. Do you want to throw anything else in there, Zian, on this?
Absolutely. For many of these points, I'm going to return to what specifically the HIPAA security rule says, just so we're speaking from the same basis. According to the HIPAA high-tech security rule, organizations are required to conduct an accurate and thorough assessment of the potential risks and vulnerabilities to the confidentiality, integrity, and availability of EPHI held by the organization. Now, in practice, you're going to want to ask yourself what is and is not a HIPAA-compliant risk analysis. Now, for the purposes of HIPAA compliance, a compliant risk analysis is a procedure that you would go through on a regular basis. We recommend annually. As Brent pointed out, the rule does not specifically state the frequency that you must follow, but what we find is that if you're doing it annually, it's very, very difficult for any auditor, including auditors from the Department of Health and Human Services, to make the case that you have not taken a reasonable risk analysis measure. Annually gets you there. Now, when you're doing a risk analysis, what you're basically doing is you're trying to identify all of the ways in which data may leave the organization in an unauthorized manner, all of the security holes that could allow that data to leave, and you're identifying whether or not policies and procedures that have been put into place are actually being followed. So in that risk analysis, you may have a person who poses as what we call a threat actor being a person who's trying to gain access to unauthorized information. And that person will try to use all means available to them to gain access to that info. This will be part of your risk analysis. And then, of course, you have to do a cost-value comparison. So you'll say that, okay, this is obviously an opening. For example, someone could kick in the door to the server room, snatch hard drives out of a server. That is definitely a risk. And the analysis portion comes in with identifying, number one, how likely is that to happen? Have you taken reasonable measures to prevent that from happening? And what would be the impact and the procedure if that particular vulnerability were exploited and that event did happen? So for HIPAA compliance, again, the rules tend to be a little bit vague, but it's really open to interpretation. And knowing that, we work with organizations to make sure that you're covering your bases to such an extent that no reasonable party could claim that you're not taking reasonable measures. If the answer sounds a little bit vague, that's intentional because the law is vague, but it's necessary that you take reasonable measures to follow it.
Now, just to clarify on the HIPAA high-tech security rule, that is the addition to our HIPAA rules that we've had since '96, but it is now incorporating electronic data. Is that correct?
That is absolutely correct.
Okay.
EPHI, obviously the E means electronic, is a terminology that came into play as part of the HIPAA high-tech security rule. And one reason for that is that the Department of Health and Human Services identified, and certain lawmakers identified, that a different rule set was necessary for the protection of, or an enhanced rule set was necessary for the protection of electronic media and electronic files. Protecting paper tends to be in some ways more difficult, but in some ways simpler. You can lock them behind a door, and you know that that paper is not going to move from that location unless someone gains physical access to it. With electronic data, however, it can be transmitted in any number of different ways, and that's why there has to be a much more stringent rule set to govern how you're transmitting that data, how that data is being stored, and how that data is being treated, and ensuring that there is a paper trail, quote unquote, of anyone who's accessing that data and why.
And it came down through with the HITECH Act, and that's why
that is
they're calling
correct.
it the high-tech security rule. Okay, that's great. Next question.
Okay.
When facilities identify risks, some of those would be identifying security flaws. Tell us about common security flaws that someone might find or try to identify.
Sure. First and foremost, before we even go into the security flaws, let's identify who the enemy is when you're speaking about security flaws. When most people think of data breaches, particularly related to HIPAA compliance, they think in movie terms. So they think of, shady hackers that are in a room with high-tech equipment, and they're trying to gain access to sensitive information so that they can either extort money from an organization, embarrass an organization, or perform some other malicious act against an individual. This is often not the case. Quite often, the most common HIPAA data breaches happen because an employee lost a laptop or traded their phone in at the Verizon store and forgot to wipe data from it, or because they connect to an insecure network like the network at your local Starbucks, and they're using a laptop that stores EPHI, and some curious party connects to their laptop looking for music files or video or whatever, and they stumble across sensitive information. Now, HIPAA does not take into account what the motive of that quote-unquote enemy is, or the person who commits a data breach. HIPAA doesn't really care what the motive is. What HIPAA cares about is that, number one, there was a data breach. Number two, that the data breach was reported as the law requires. And number three, that reasonable measures were taken to prevent that data breach in the first place. So that's first and foremost. Now, most common security flaws, the biggest one that we see is failure to encrypt files at rest. Okay, so if you're not encrypting the data when it's sitting on a device, okay, and this means that whether it's an encrypted hard drive, whether it's software encryption, whether it's encryption within your email account, whatever the case may be, when that data is sitting in a single location and not being moved, it must be encrypted if it contains any EPHI whatsoever. And this is one item that there is no ambiguity within the HIPAA security rule. It is absolutely required. All right. Also, failure to encrypt mobile devices. A lot of people don't realize that most mobile devices do not implement good encryption standards. If you have an Android phone, for example, it's very difficult to encrypt data on an Android phone. It is, by definition, an open platform, and encryption of data on there is quite difficult. Apple devices and Windows mobile devices make it a little bit easier, Windows being the easiest of them all, and that is generally considered to be the most secure platform. But again, the HIPAA rule does not specify specific vendors that you must go with. It specifies that you must encrypt that data when it is sitting on any device whatsoever. And that's an extremely common potential data breach or extremely common violation of the HIPAA security rule.
And see, wouldn't you say that email is one of the biggest fatal areas that we're seeing right now is doctors emailing patient information back and forth to each other on their mobile device, and the mobile device is not encrypted. And if they lose that device, so basically all those emails basically are PHI and they're at risk of a breach from that standpoint.
You're absolutely correct. Unencrypted transmission of ePHI is another big security hole that a lot of organizations fall into. Many people, take lots of measures to encrypt hard drives. They will password protect everything, but then they'll send an email with personal information, and even information as simple as, Mrs. Jones came in for her examination today, and the initial diagnosis was this. That is a violation of the security rule, unless that email transmission is encrypted, both in transit and on the other end, or if you have a reasonable belief that it is encrypted on the other end. So that's another big one. Also, failure to have a vulnerability assessment or risk assessment at regular intervals. That's another very common violation of the security rule. Another very big one is failure to provide staff training. You can have the most robust policies, you can have the most robust procedures, you can implement encryption, you can implement end-to-end encryption, you can have every security measure in the world, but if your employees don't know what those security measures are as it relates to their job, and if your employees don't know what their roles and responsibilities are in relation to those, then it's the same as having no policies, procedures, or controls at all. So that's another big area that a lot of people overlook when it comes to HIPAA compliance. Now, also, the failure to implement a compliance-focused policy and procedure framework. Lots of organizations have policies that may say and a policy is a broad statement, so a policy may be, we encrypt all data when it's at rest. But if you don't have procedures to back that up, then it's almost the same as having no policy whatsoever. So those are some of the most common ways. There are some less common ones, but these are the ones that we see over and over again. And again, because much of the HIPAA security rules are open to interpretation in the event of an audit, you want to make sure that you're taking reasonable steps to meet all of these so that if you are audited, if you do wind up in a situation where there is a breach and then there has to be due diligence to figure out how that breach occurred, you want to make sure you're covering your bases. And if you've covered these items that we're mentioning here, there's good basis to assume that the finding will be that you did take reasonable measures, but those measures were circumvented.
Okay, next question. You touched upon this file at rest at the beginning of the last question. Talk a little bit more about that so that we understand exactly what that means.
Sure. And again, as we've done before, let's first mention what HIPAA says. So, quote unquote, HIPAA states that a covered entity must, in accordance with Rule 164.306, implement a mechanism to encrypt and decrypt electronic protected health information. Now, what this really means in practice is when data is at rest, and what that refers to is data that's stored for any period of time on a server, on a hard drive, on a workstation, on a laptop, on a tablet, a smartphone, an email application, in a database, on a thumb drive, on a CDR, on a DVD-R, or on any other type of electronically readable medium. That includes if you're scanning documents. So if you're taking paper documents and you're scanning those to PDF, guess what? You just converted your PHI into ePHI, and so encryption at rest rules apply even then. So what types of data need to be protected of ePHI? Some people make the mistake of assuming that that only includes traditional files. It does not. Data that's stored within an email account. So if you're sending, even if it's encrypted in transit, if you're sending an email that has ePHI in it, now that ePHI needs to be encrypted, or the email account within it sits needs to be encrypted on both ends. Now, obviously, you're not going to be in control of what another organization does, and that's why you would have a business associate agreement with that other organization. Basically, that's their assertion, and you would present that in the event of an audit, stating that this other entity has asserted to us that they are compliant with the statutes from the HIPAA high-tech rule in particular for the protection of ePHI. So, again, any email account, any database, any electronic documents, including scanned documents, any files stored on any electronic medium whatsoever, including hard drives, CDs, thumb drives, and so forth, those things must be encrypted as they are sitting. And what you're protecting against when you do that is if someone gains unauthorized access to it, meaning if someone pulls a hard drive out of a server, which is very easy to do. If someone loses a laptop, it guarantees, or encryption gives a reasonable level of guarantee. There's no true guarantee. Encryption gives you a reasonable level of protection against someone gaining access to the hard drive within that laptop and reading the data. If data is encrypted on a mobile device, someone trades that device in, someone leaves it at an airport or in a taxi cab, it gives you a reasonable level of protection against the next party that gains possession of that device reading sensitive information that's stored there. These are the things that the HIPAA high-tech security rule is really concerned about when it comes to encryption of data at rest.
If you're looking at someone's health information about anything about that person electronically on any device, that needs to be protected.
Absolutely. And later in the discussion, we'll get into a point-by-point discussion when we get to question 5. That'll be a point-by-point discussion on exactly what constitutes EPHI.
Great. Next question is about mobile technology. Everybody has mobile devices today. It's here to stay. Tell us about that. What is considered mobile data when it comes to our healthcare, and why does that need to be encrypted?
So mobile devices refer to any device that is, by definition, intended to leave the protected boundary of an organization. So your desktop computer is not considered to be a mobile device. Yes, it is possible that a malicious party could walk into the office, pick up the desktop computer, and walk out with it. However, it's unlikely. Generally, your organization is going to have some type of security measure. If it's not a full-time security guard, you at least have cameras. You've got alarm systems and so forth. So the assumption is that desktops, servers, SANs, which are storage area networks, or NAS devices, network access storage, those are things that generally would not leave. However, any device that is intended to leave the protected boundary is considered to be mobile. That is a laptop computer, a tablet computer, a smartphone, for example. Those are mobile devices. Now, in terms of encryption on a mobile device, the HIPAA high-tech security rule doesn't specify specifically how those must be treated in comparison with a stationary device. However, common sense measures state that you would take even higher measures with a mobile device than you would with an on-site device. If it's within your network, you're assuming that a person is not going to walk into your office, sit down at the computer, and start using it, because they'd have to pass numerous parties who would recognize that they're not supposed to be there in the process of doing so. With a mobile device, however, it becomes much more ambiguous. The laptops get left all the time in taxi cabs, or mobile devices get dropped. And those things, you must assume that at some point someone may gain physical access to the device who's not authorized to read the information on that device. And that's why encryption is so important. If you have properly encrypted a mobile device, even if I have physical access of that device, I have no means by which I can read the information stored thereon unless I have the encryption key, or unless I have access to whatever de-encryption measures have been employed for that device. In the absence of those, physical access to the device gives me nothing except a device that is all but useless to me. And that's what's necessary as far as HIPAA compliance is concerned with mobile devices.
Okay. I think now's the time we're going to go back to the electronic protected health record. Let's talk about, next screen please. Another type, the other type is electronic health information. What is this, and why should that be encrypted?
Okay. So EPHI refers to any of the following that can be derived from an electronic data set. That includes a person's name, any geographic subdivision smaller than a state, and that includes street address, city, county, precinct, zip code, or equivalent geocodes, so that would be coordinates. Okay. Any elements of dates that can be traced back to an individual, including their birth date, their admission date, their discharge date, the date that they died, the date that any major event took place in their lifetime, telephone numbers of individuals, fax numbers, email addresses, social security numbers, of course, medical record numbers, health plan beneficiary numbers, account numbers of any kind, certificate or license numbers associated with an individual, any vehicle identifiers that can be traced back to that individual, biometric identifiers such as retinal scans, fingerprints, voice prints, any of the following. Okay, photographs of an individual, that's a very important point, and any comparable images. And that doesn't just include photographs of the face, that includes photographs of any body part that is distinctive. And any other uniquely identifying number, characteristic, code, or anything that could be used to trace back a record to a given individual. Those are things that would constitute EPHI. Brent, do you have anything to add?
No, you got that one.
Okay, great.
I think the picture one is kind of new, and because not everybody takes pictures, but that identifying marks, if you're taking a picture of a shoulder or a back or something and it has a tattoo on it. That's
correct.
Absolutely.
Right.
Absolutely. Anything, and again, this is one of those areas that it's open to interpretation. Some people may look at a photograph of a tattooed shoulder and not think of that as being individually identifiable, and others might. Again, it's better to exceed the level of the law than it is to fall short of it. And so it's very important that if it's anything that could potentially be used to identify an individual, that is protected at the same level as a full-face photograph or a name, a social security number, and so forth. And in terms of administrative overhead, it's a lot easier, and it takes less administrative overhead if you apply those same measures to every aspect of the patient record than it does if you try to pick and choose and apply a different level of protection to different areas within that record set.
Okay. Tell us about, you discussed at the very beginning this vulnerability assessment. Let's get more into that and tell us about what we need to know about that and how we do it.
Well, one of the things that we like to make a distinction is that we don't use the word penetration testing, which is a lot of people, they kind of equate the two. So from a definition standpoint, a penetration test is basically, from our point of view anyway, is a active hacker trying to actively hack into your systems, which is really not what you need to be protected from. Basically, when you're in that situation, you have an offense versus a defensive situation, and offense almost always wins. Defense is static. Really what we're more concerned with is, are there vulnerabilities that can be exploited accidentally or by people that aren't that technical and can get in anyway. So what we look at is we do an internal and an external vulnerability assessment. And to define those a little bit more, on both sides we also do informed versus uninformed. So let me explain what those are. Internal is inside your domain, inside your walls. So what we're going to look in is can we get onto your guest wireless? Can we get into your network? Can we just plug into the wall? Can we get into your network? We simulate from an informed standpoint possibly an ex-employee or maybe a salesperson getting on the guest wireless. Can we use credentials, old credentials, and get in? Basically somebody who might know something about your network or something about your domain, can they get in? Can they get places where they're not supposed to be? And we're going to simulate those types of we're going to be looking for those kinds of vulnerabilities. And we do that on the outside as well. So driving by, can we get on? If we're outside the walls and we're out in the street, can we get in through any of the wireless points? On an uninformed side, it's the same type of thing, but now it's just what it says. It's somebody who knows nothing about your environment and is actively trying to look around and see if there's anything that they could get into, any kind of trouble that they could get into. From a standpoint of why is it necessary, again, this comes right back to the HIPAA rule, and I'm sure, Zion, you probably have that right there that we can talk about. If you want to, do you have that?
I sure do.
Why don't you go ahead from there then?
Okay. So when it comes to HIPAA compliance, HIPAA states exactly this, and this goes back to the risk analysis. It states that an organization must conduct an accurate and thorough assessment of potential risks and vulnerabilities to the confidentiality, integrity, and availability of electronic protected health information held by the organization. Now, vulnerability assessment is a subset of an overall risk analysis framework. You may perform your vulnerability assessment at the same time as your regular risk assessment. You may perform that staggered against a risk assessment framework. So let's say, for instance, your formal risk assessment might occur in January of every year, and your vulnerability assessment may occur in June. which gives you enough time between June and the following January to implement reasonable remediation measures. The biggest thing I'd like to add to what Brent has already pointed out is that no one passes the vulnerability assessment. So, and I'll say that again, no one passes. Whenever a vulnerability assessment is conducted by a reasonably competent organization, and definitely Falcor is one of those, we always find security holes. We always find something that is not being done at the level that it should be done or that it could be done. And so, and this is what occurs at the beginning. Now, obviously, once you have had a few of these done, you've implemented reasonable remediation measures, then things start to look a little bit better. Then you get to the point where you're passing the majority. However, there will always be certain things, unless you have an unlimited budget, there are always going to be some security holes that could potentially be exploited. That's where risk analysis comes in. That's where you basically identify, here's what the risk is, here's the cost of remediating that risk, and here is the danger associated with that risk being exploited. And then you make a judgment call based on whether or not it is more expensive to close that hole, or is it reasonable to leave that hole where it is but document it and apply reasonable controls so that you can identify if something is exploited. But again, no one passes. It is to be expected that you do have security holes. They are going to be, just by virtue of using computers and being connected to the internet, a network could potentially be breached. The question is how much data could be accessed, what types of data could be accessed. That's where that risk analysis and the judgment call comes into play.
Okay. Training. Let's move over to training. Training is the major part of every aspect of health IT adoption. You're not going to have success in any part of it if you don't do the correct training. Tell us about what types of training are required when it comes to HIPAA compliance.
Sure. So first off, HIPAA requires that all covered entities train all employees, volunteers, temps, trainees, and anyone else who represents the organization regarding privacy and security policies and procedures. Obviously, the role of a physician is going to be different than the role of a receptionist in implementing proper security controls. So the training must be tailored to each job function and what types of information that person is going to be privy to. The key thing that HIPAA specifies is that all employees must be trained. It doesn't specify what level of training must be applied to each employee, but they must be trained in accordance with their job function. If you have an employee who has access to EPHI, then it's obvious that that person is going to have to be trained on where their role fits within things like encryption at rest or encryption in transit, such as you might have a policy that says all email traffic that contains EPHI must be encrypted. That may mean that you use an alternate email program for sending any emails that contain EPHI. Perhaps you're using Microsoft Outlook for normal communication, and you have a webmail program that you use if you're sending an email that contains EPHI. That would be where your policies and controls come into play, and obviously for that to be effective, all employees that are transmitting or receiving that information would have to be trained on those programs and on what the responsibilities are associated. A very key portion of HIPAA compliance, and again, it must be tailored to each individual job function.
And you must have a security officer designated as well, and they go through specific training as well.
That is correct.
What's a security officer?
Oh, definitely. So the security officer, or for the sake of HIPAA, the term that's used is privacy official. That's the exact term used in the statute. Each covered organization must designate a privacy official, and that person is, quote unquote, responsible for the development and implementation of the policies and procedures necessary for compliance. Now, in small organizations, this is normally going to be either an office manager or a physician who takes on the added role and training that supports that added role. In mid-sized organizations, that may be a single 100% dedicated individual whose whole job function is maintaining the privacy and security of the organization and providing oversight. And in very large organizations, such as a hospital, this would be a whole department, and that's all that they do is they routinely audit, monitor traffic internally. They routinely check and make sure that these rules and policies are being covered. Key responsibilities of the privacy official would be creating and posting and distributing notices of the rules, regulations, and practices. In facilities with direct treatment providers, they would be securing and recording each patient's acknowledgement of receiving it. So you may have a security person or someone from that department who walks into the room, and they actually have the patient sign off on a particular section, and they are the witness that that patient has signed off on release of information and so forth. Now, that may also be a role that is designated to individual nurses, so you might take certain pieces of the job role and you break those up amongst other members within the organization. So you still have a designated privacy official, but then they have delegates within the organization that are empowered to take signatures and explain certain rules to patients and other employees. Also, the privacy official. Also, the privacy official is going to be responsible for processing authorizations for certain types of deviations from normal security procedures. So if for some reason you need to give, let's say, an IT consulting provider access to a system that normally only physicians and nurses would have access to, that would be the person who would be responsible for taking the non-disclosure agreement, taking the business associate agreement, filing that, and making sure that that IT services provider has covered all of their bases in making sure that they're meeting their obligations with the HIPAA security rule. So those are some of the key areas of responsibility.
It's important to note, though, that we're seeing a lot of organizations getting fined out there for not having a designated officer. So it's something that people are kind of skipping over, and they need to take the time to designate that person within the organization and make sure they get the proper training in case they do get it audited, because we are seeing fines being held out, being levied just for that what seems like a small infraction.
And that, and you made a good point there. Training. There's specific training for privacy officers, especially in the smaller facilities that usually the practice administrators taking over, or the doctor. Specific training. It's good to have that, have a certification that gets you even a better check when you go and have an audit.
Yeah, absolutely. Absolutely.
Get certified and be an actual privacy person. Considering
the amount of the fines, it's worth the time. Mm-hmm. So yeah, we would highly recommend it.
They also, when you become trained and you're certified as that privacy officer, you then can understand what you have to train your people to know also.
Right,
so
exactly.
Yeah, so you're bringing the knowledge into the facility.
Another key area I'd like to highlight regarding a privacy official is that it's very important that the person designated as a privacy official or compliance officer is more knowledgeable about the rules and statutes of HIPAA compliance than your employees, your trainees, and anyone within the organization would be. And this is very important for the following reason. I haven't seen an organization yet that hasn't fired someone, that hasn't let someone go under circumstances where that individual was not happy about the separation. And if you are not more knowledgeable, or at least as knowledgeable about what your obligations are than the people who you have within the organization, then you open yourself up to the possibility of just one disgruntled employee or ex-employee picking up the phone or sending an email and contacting the Department of Health and Human Services. And the fines and the penalties against organizations that do not self-report violations, that do not self-report breaches, and those reports of violations come from third parties, can be pretty steep. So you want to make sure that the individual who is kind of at the head of your compliance practice, so to speak, is reasonably knowledgeable so that they can catch and make sure that any violations are reported as the law specifies, and that they're taking reasonable measures to document and protect against any vulnerabilities or risks before a report comes in from a third party, because if it does, the steeps and the penalties can be pretty severe.
And I believe that most of the HIPAA audits now that take place start by someone reporting them.
Yes, absolutely.
That's, yeah. Mm-hmm.
It's been our experience as well.
Yeah, I think that's pretty much. Okay, so let's, you talk about, we've been talking about a compliancy officer. What's a compliance policy?
So compliance, go ahead, Brent.
Yeah. I'll take a stab at this and have you add in. One of the things that we see with this is the part that seems to scare people the most, and it doesn't have to. Basically, from a policy standpoint, we've defined this here as the broad rules which support an organization. But and we put this example here: all ePHI must be encrypted at rest. Policies really are that simple. They're just not done. So sometimes we talk to organizations, especially smaller practices, they get really hung up on, we've got to have policies, procedures, and controls, and we have to write this humongous manual and go through this whole thing. And that's not necessarily the case. You just have to have written statements as to what what your rules are. So again, a policy example is very simply all PPHI must be encrypted at rest, and then we go right into what's the procedure. Well, and that's the how. So if you look at a policy from a standpoint of the what, it's a what statement, and then go right into your procedures as to, okay, so how are we going to do that, and how are we going to affirm that we've done that? It makes it a little more simple and a little less scary, but that's an area when we come into the risk analysis that we're going to want to look at those. If you don't have them, then we're going to try and help you create them, and then go from there. Most of the organizations that we deal with haven't even touched this area, and this is an area where they're very far out of compliance. Would you agree, Zian?
Absolutely. The way that I usually term it when explaining the differences between particularly policies and procedures to an organization is that a policy is a goal. A policy is, we are going to do X, okay? And then your procedure is the exact plan by which you get there. So you say all ePHI must be encrypted at rest, and that would be your policy. Your procedure, however, is going to be the specific measure by which you encrypt the data while it's at rest. Policies do not change very often. Generally, you'll put in place a policy and it will not change until the legal statutes change or until your areas of focus as an organization change, and those things don't happen very often. However, your procedures change all the time. If you go from one email program to another, procedure might change. If you go from one encryption provider to another, procedure might change. So the procedures are really where the rubber meets the road, and that's what is going to change on a regular basis. But a compliance policy, that's something that is not going to change very often, if at all.
And Zian, just because, and we're kind of skipping into the next slide, but why don't you just talk a little bit about the different what a control actually is? Because I think that I know our clients get hung up on that word as well from a definition standpoint.
Mm-hmm.
Sure, absolutely. So procedures and controls, in some cases they're used as interchangeable terms. They should not be. They are very different things, even though there is a little bit of overlap between the two. Let's say, for example, in the transmission of email. So if we have ePHI that must be transmitted via email, I'll have a very specific procedure that says any ePHI must be transmitted using this specific program. So content must be copied from this location, pasted into the webmail program. It must be sent to the following address at this following organization for any ePHI that is transmitted between organizations. That would be my detailed procedure. The control is how you actually verify and or protect against a violation. So your control might be an email filtering program that looks for social security number patterns, for example. So if you have a pattern of 3 digits followed by a hyphen, 2 digits followed by 4 digits, that's a pattern that would match a social security number. And so my control is an application that sits between the two or sits at the border of the organization and monitors all email communication, looking for anything that matches a particular regular expression or a particular text pattern. That's what the control would be. So procedure, again, is exactly the steps by which you work toward the achieving of a particular compliance with a particular policy. Control is the measure that you take to verify and or prevent violation of a given procedure.
Technical, but important.
Very true. Very true. And often overlooked.
Yes, and go back and read that slide again when you get the slide decks. Let's take a bigger view to kind of end this all out before we get to some questions and answers, can you walk us through what we should expect during a risk analysis or a vulnerability assessment?
Well, Zian, that's mainly your team, so I'll let you head that one up.
Okay. So first and foremost, when we engage with a client to perform a risk assessment or a vulnerability assessment, the very first thing we have to do is define the scope. So we identify how many systems are being analyzed, what systems store ePHI and which systems do not. How is data generally accessed within the organization? So the very first portion is that we would either come in physically or we would do it remotely, and we speak to key stakeholders and identify exactly how is your practice structured. How do you receive patient records? How do you transmit those patient records? Where are those things stored? How are they stored? What measures have you taken in the past? Is this your first risk assessment or your first UV's provider didn't cover a pair of eyes on things? So the first step is definitely going to be a discovery process. Second step is going to be analysis. So that's where we've identified what are the key systems that must be analyzed, and then we go in and look at those systems in depth. Now, there are some terms that Brent threw at you earlier in this discussion, those being external versus internal, informed versus uninformed. External and internal are very self-explanatory, so I'm not going to dig into those too deeply. Informed versus uninformed, however, requires a little bit of explanation. An informed assessment is a module within the assessment or the overall assessment framework where we look at your systems and we analyze your systems from the standpoint of a person who already knows about those systems, that being an employee, that being an IT services provider, or any other party who knows what the key or target systems are and has a reasonable amount of information for identifying where sensitive data might be stored. That's informed, and that's definitely where we uncover the majority of the security holes. However, it's also very important to have an uninformed assessment module, and that's where we'll take a different subset of our analysis team who is not given really any information about your systems. They don't know which systems are the ones that store sensitive data and which ones are not, but they try to attack them all. They try to gain access to sensitive information on anything that may store it, and they look at everything in depth. That's extremely important because that's going to be a very common way. There are lots of, for instance, if you have a patient health portal that is accessible from the web, you will have quite often a malicious attack that starts with an electronic program. So a third party might have a web crawler that just crawls any health portal that they find looking for common security holes, and then once they find them, it flags those for a human being to review and try and gain greater access. We would follow that exact procedure, and we would follow it until we reach the brick wall that you hopefully have in place that prevents further access. That then would dovetail back to the informed process, and then we would take the results of both and we provide you with analysis, recommendations for remediation, and so forth. In terms of the time expectation, because that's another area of concern that a lot of providers have, so particularly small doctors' offices, health insurance organizations, especially the small ones, they don't, they have full-time jobs. Your full-time job is not necessarily to be HIPAA compliant. So you're not going to want to invest a significant amount of time in hand-holding our staff in analyzing your systems, and we don't expect you to. What we do expect is that key stakeholders will make time to answer some key questions, to provide us with enough information so that we can perform the informed portion of our analysis and identify what remediation measures will fit within your corporate culture. So obviously, we could make remediation measures or remediation recommendations that would absolutely cripple your organization's operations. That's not what we want to do, and that's why it's important that the key people, make time for us to be able to ask questions, understand what are your practices, what's your workflow within the organization, so that we can tailor our recommendations to how your organization does business, and that's a very important point. How much time specifically has to be spent? It's going to vary from organization to organization. However, it is important that reasonable time be taken, and we will obviously be considerate of your time. It is valuable, and make sure that we're not taking an inordinate amount of it.
Well, it's something that everybody has to look into. You know, patient data needs to be secure, and it's not just the law, it's the right thing to do. I think we're now to the question and answer portion. We're going to have to bring Sarah in on this. Sarah, can you hear us?
Yes, I can. Brandon, Zian, thank you very
great.
much. Thank you very much for an informative and comprehensive discussion. We do have quite a few questions, which I will get to some of them for the audience. Any that are not addressed specifically on this webinar, they will be posted as well in a follow-up, the questions and answers. So let me get started. It was my understanding that encryption was listed as an addressable measure and not required. Could you tell me what rule states the requirement of encryption?
Sure, absolutely. Give me 1 second to get to that portion of my notes here, and I can tell you that. Okay, this is within section 164.312, and the exact wording is a covered entity must, in accordance with section 164.306, implement a mechanism to encrypt and decrypt electronic protected health information. That is verbatim from the HIPAA high-tech rule.
Okay. Does a privacy officer have to be on site, or is this a person that can be hired by the office or clinic?
No, the privacy officer does not need to be a full-time employee of the organization. In fact, that's a major area of consulting practice that Falcor provides, and we have other partners that do so as well, that provide HIPAA compliance officer, privacy officer services. It really depends on the size of the organization, because obviously larger organizations with more robust data sets will require more dedicated time. So if you have, let's say, a mid-sized practice or a large practice, and I'm defining mid-sized or large as, let's say, 75 or more physicians, that would generally require a full-time employee to be involved in privacy and compliance as the privacy officer, because it really would be a full-time job, just policing and just making sure that staff is being trained adequately and all reasonable measures are being taken. But for smaller organizations, it is not uncommon. In fact, it's probably advisable to outsource that particular position.
Okay, thank you. Does the data in an EHR database have to be encrypted?
Yes.
Okay.
There's no ambiguity about that. That constitutes data at rest, and that data must be encrypted. Anyone who gains access to the database application or the files that power that database, if that information is not encrypted, if it's stored within plain text, then that is a very clear violation of HIPAA high-tech rules.
Now, can I interject on ONC certified EHRs? That is one of the specifications. So if you're using that type of technology, then you're okay, correct? Am I correct?
Absolutely.
Okay.
That is correct.
All right.
Okay, thank you. If your business has deployed Android devices, you said it's not easy, but I'm assuming it is possible. If so, what tools are available to encrypt Android devices?
It is not easy, and I'll explain why. Apple devices and Windows devices, if you choose to implement those safeguards, are by default locked down to a certain extent. You can't just plug them into a computer and read all of the content that's stored on there. Apple devices, you definitely can't do it just by default, and Windows devices, it's pretty easy to switch that functionality off. With Android devices, however, Android is an open source platform. It is an open platform by definition and by design. So as a result, any data that you store on an Android device is generally not going to be encrypted, and it's generally going to be readable by anyone with a USB cord that can plug it into a PC. That being said, there are software utilities, and it's outside the scope of this discussion to get into specific products and make specific product recommendations, but I can say that there are applications that are available for Android that are integrated with most of the major EHR solutions and EMR solutions. And those particular applications, as long as only those applications are being used for entering, reading, and transmitting sensitive health information, particularly referred to as EPHI, then that would generally be considered to be compliant. But if you're using the built-in email program, if you're using the built-in browser, assume that it is not secure.
Okay, thank you. If a patient signs a release and asks for this to be emailed to the Gmail account, to their Gmail account, and we know it is not encrypted, is that okay if they sign asking it to be emailed?
No, it is not okay. Even if a patient signs something asking for it to be sent, generally, because here's the thing, that patient might be authorizing you to give that information to them, but the Gmail account is in and of itself not considered to be a secure platform. Therefore, you would not generally email to that particular account sensitive information. Are there ways that you can work around this? Absolutely. You would not email, let's say, a specific diagnosis. You would not email specific information that is related to that individual. So you wouldn't send, let's say, the health record to the Gmail account. However, you might send generic information about a given condition. So you might send an informational flyer or PDF file or an informational email saying, this specific condition, this is, these are the symptoms, this is recommended action and recommended treatment path and so forth, but not something specific about that individual. That would generally be considered to be a breach of the HIPAA security rules if you email specific patient information to a given account.
Okay. We're beginning to run out of time, so this will be the last question that we asked during this webinar. And as I mentioned before, all of the questions and answers will be posted in a follow-up after the webinar is over. So this last question is, to what extent does HIPAA require a business continuity plan?
So as part of any reasonable risk assessment framework, things that are going to come into play are, and this goes into some of the other information domains that are contained within HIPAA, such as confidentiality, availability, and so forth. Business continuity plans fit within the availability framework, and that's obviously extremely important. So you have to, as a covered entity, as an entity to which the HIPAA security rules apply, you have to take reasonable measures to make sure that EPHI is available at all times that it is required to be available. And that means to answer any requests by patients, to answer any requests by the Department of Health and Human Services, and to satisfy, obviously, the needs of the organization itself. The business continuity plan is part of that. Now, if you have in place a disaster recovery policy and a business continuity plan, as we back up all data and we have this exact plan for making that data available in the event that our facility becomes inaccessible, based on our analysis of the HIPAA high-tech security rules, that does meet the requirements. However, in practice, if you were to become audited and that's all you had, you probably would get dinged for it and potentially fined if you're not taking more robust measures to make sure that you're back up within a reasonable amount of time.
That's great. Thanks, Sarah, for chipping in there on the Q&A. Our time's up for today. We want to remind everybody again to expect that email with the questions, answers that are remaining, plus the slide deck, plus the recording in your email. A special thanks to our experts, Brent and Zion, for joining us today on another Learning Lunch. Thanks, guys.
Thank you for your time.
And thank you, attendees, for spending your lunch with us. Be sure to join 4Med Approved for the next Learning Lunch tomorrow on May 8th, when the topic will be utilizing EHR templates to improve workflow. Keep an eye out in your mailbox or visit us at www.4medapproved.com for more upcoming topics. Goodbye for now.